Dangerous Dan got his nickname Dangerous. From when he was a small child, he had always tried to take shortcuts, such as ignoring safety rules, and was always getting hurt or creating dangerous situations. His pattern of behavior persisted into adulthood when he joined the labor force. He worked at a sawmill for about 6 months until he lost 2 fingers in one of the saws. Because he ignored the safety rules, because he didn't lose a thumb, he didn't qualify for disability, but did get fired for ignoring the safety rules. Dan next got a job working for a moving company. Working for the moving company involved lots of heavy lifting. The company had safety rules for lifting, which Dan, of course, ignored. Subsequently, Dan developed a rupture or inguinal hernia, which caused Dan to have pain in his groin. Dan had to have surgery to repair it, but it was not severe enough for Dan to get disability, so he had to get back to work after about 2 weeks. Besides being dangerous, Dan was also stubborn and did not learn anything about lifting after having developed the hernia. So then Dan began having low back pain along with numbness down his legs. Dan went to see Dr. Bruce about his back pain. Dr. Bruce saw Dan in the ER at St. Mickey's Memorial Hospital and sent Dan for an MRI of the spine. MRI is a study that uses magnets to image the spine. On the MRI, there was an area where a disc was bulging out and pressing on a nerve root. Dr. Bruce then got an orthopedic consult. The orthopedic surgeon needed to pay for his son A.S. college tuition, so he decided to operate on Dan A.S. back. The numbness in the legs got better with the surgery, and so did the back pain. After recovering from surgery for about 6 weeks, Dan was allowed to go back to work. Naturally, Dan re-injured his back in no time flat and went to see Dr. Bruce. Fortunately, there was no evidence of a bulging disc, and repeat MRI was normal. Dr. Bruce felt that Dan just had some muscle spasm and gave him a prescription for pain pills and muscle relaxers. During the time that he had been recovering from surgery, Dan had gotten into the habit of drinking a 6-pack of beer because he liked the taste. He used the beer to take his pain pills and muscle relaxers and then decided to go for a drive. Dan, of course, did not believe in seatbelts, so when he had the close encounter of the third kind with the oak tree, he ended up kissing the tree trunk after going through the windshield first. After months of hospitalization and rehabilitation and several $100,000 in medical expenses, Dan was allowed to go home in an electric wheelchair, which he controlled by blowing through a straw, and he finally got his disability. Moral: if crashing your car into a tree is what it takes to get disability, then you're better off working